A 28-year-old man goes to the gym, active, fit, and in the middle of a routine workout. Minutes later, he collapses. Medically, a heart attack occurs when a clot prevents oxygen from reaching the heart muscle. For a century, doctors categorized this as a disease of the elderly, the final result of decades of arterial wear and tear. This graph compares cardiac incidents over the last 30 years. While the rate for older patients has remained relatively stable, the line representing the 25 to 40 age bracket is trending sharply upward. In many of these younger patients, there is no history of chest pain or gradual decline. The first indication that anything is wrong is often sudden cardiac arrest. Seeing failing hearts inside physically fit bodies suggests that our internal systems are colliding with a modern environment they weren't built to navigate. Human biology evolved over millennia to function under conditions of constant movement and natural food sources, but in just a few decades, those conditions have been replaced. Young adults spend more time sitting, sleep fewer hours, and rely on ultra-processed diets designed for shelf life, not metabolic health. These factors trigger metabolic shifts long before they are visible in a mirror. Chronic sleep deprivation and processed sugars drive insulin resistance and the accumulation of visceral fat around the organs. This demographic is also the primary consumer of modern stimulants. Vaping, high-concentration nicotine, and energy drinks containing extreme doses of caffeine have become daily staples. Combining these stimulants with a baseline of chronic exhaustion forces the heart to operate at a higher intensity than its biological limits allow. High-dose caffeine and nicotine act as constant chemical stressors, placing the cardiovascular system under a level of strain that the human heart was not designed to sustain. Beyond diet and stimulants, the chronic stress of modern professional life creates a direct physical pathway to arterial degradation. Our fight-or-flight response was built for short bursts of survival, escaping a physical threat and then returning to a state of rest. When the brain perceives constant pressure from work or digital connectivity, the adrenal glands continuously pump adrenaline and cortisol into the bloodstream. This constant hormonal flood keeps blood vessels constricted, elevating blood pressure. The sustained pressure creates turbulent blood flow, inflaming the vessel lining and causing microscopic tears. These tears catch cholesterol and debris, building plaque until the vessel narrows and blood supply is choked off. By the time a blockage becomes severe enough to cause chest pain, the underlying vessel structures have been undergoing this decay for years. Because this damage happens internally, a person can exercise daily and maintain a lean physique while still harboring advanced artery disease. Young people often attribute warning signs to simple exhaustion. They ignore persistent chest pressure, unusual fatigue during light activity, or a sudden shortness of breath. Other signals include pain that radiates into the jaw or down the arm, unexplained bouts of dizziness, or sudden cold sweats that occur without physical exertion. Relying on a low age or a gym membership as a reason to ignore these symptoms is a dangerous gamble with biology. Since many of these changes are silent, proactive screening is the only way to detect metabolic disease before it triggers a cardiac event. This checklist identifies the specific tests to discuss with a physician. It focuses on lipid panels for cholesterol, inflammation markers, and tracking consistent blood pressure. These tests help identify hidden risks like hypertension, prediabetes, or fatty liver, conditions that often persist without outward symptoms. Doctors use these physical metrics alongside a review of family cardiac history to identify genetic risks that blood work alone might not fully reveal. The rising frequency of heart attacks in younger adults is a measurable reaction to the modern world. Surviving it requires us to actively manage the biology we inherited.